Good morning, everybody, and welcome to Health Talk. I am your host, Dr. Niru Prasad, with my background in pediatrics, emergency medicine, urgent care, affiliated with major hospitals, St. Joe, Oakland, Beaumont, and Henry Ford. The theme of our health talk today is a weight reducing process. Joining us today is Dr. Sonali Hamchandra. She is specializing in obesity medicine, which is obesity medicine, and she is going to highlight our viewers about which way we should all progress to stay healthy and reduce our weight to our baselines. So, good morning, Sonali, and welcome to Health Talk.
Good morning, Niru. Thanks for having me.
Yeah, and before I go, can you please give your introduction? You must have a very interesting background.
Sure. So I'm Dr. Sonali Hamchandra. I'm board certified in obesity medicine.
Okay.
And I actually was a practicing infectious disease physician for many years, but
okay.
I always had a passion for figuring out why I was gaining weight and trying to figure out solutions for that. So along the way, I switched course and now am coaching women, specifically menopausal women, on weight loss.
Okay.
Yes.
So your basic specialty is coaching the menopausal women,
Yes.
which makes sense, because during the early stage of life, everybody is conscious and they do. But once they reach the menopause age, people are kind of sedentary, right?
Right. There's a lot of factors working against us once we've reached midlife, whether
Right.
it's being sedentary or having lost some muscle mass just due to the aging process, or
Right.
having been on fad diets. So there's a lot of things making it more difficult to maintain a healthy weight.
Right, yeah. So that's very good. So you recently launched a wellness coaching practice.
Right.
Can you highlight our viewers about that?
Right. So, my goal with the coaching practice is to bridge the gap between the medicine side and
And the-
actual lifestyle side.
Okay.
Because I think, we can go on a diet, we might be on a weight loss medication, but
Right,
then
yeah.
figuring out how to live, how to make those choices with what you eat,
Correlate both
your
those.
habits. Yeah, so I felt there was a missing piece that I could fill.
Okay, collaboration between
Right.
that. This is your goal for the wellness coaching practice, right? Okay.
That's right.
Okay. So what are the key points to hit here? Yeah.
So the key points are, and again, I'm targeting women in midlife. It's focusing on longevity and focusing on what's sustainable. So if we look at weight loss as more of a holistic process where we want to get adequate nutrition, maintain our muscle mass, we take the focus off just the number on the scale and we look at actually being healthy and feeling good while we achieve a healthy body composition. So not just losing, the number on the scale, but we want to lose fat but maintain muscle and lean mass.
So most of it, maintain the muscle, because
Yes.
I see our children and grandkids, and oh my God, their muscles. I say, Grandma, look at that. Of course, mine is so flabby.
We can all make progress no matter how old we are. So that's the good
Right.
news, is you can always
Yeah.
improve.
Yeah, right. So then what exactly is weight coaching? How does it different from patient typically get from their doctor?
Right. So, a typical doctor's appointment, it's very short. We may have 10 or 15 minutes to spend with our patient.
Right.
And there's so much
How much
to.
can you tell them?
Exactly.
Yeah.
So, coaching allows me to spend a lot of time figuring out and helping people with whatever's getting them stuck, whether it's self-sabotage habits or snacking. It could be, any type of mental drama like that,
Yeah.
along with coaching them on how to eat and the right movement.
Yeah.
And so it's
So-
supplementing the medical
Yeah,
side.
so basically, when the patient come to me, there's assigned time. How much can you talk to them? But when they go to you in your program, you
Right.
sit with them and you spend time,
Yes.
maybe in 30 minutes and an hour, depending upon it.
That's
So
right.
what is the difference from a typical doctor's visit? Can you comment on that?
So the difference between a doctor's
What
visit
are
and
the key points to hit?
Oh, during a doctor's
Yeah,
appointment?
right, yeah. Body composition, not weight, and
Right. So when someone is going to their doctor for weight loss, I think it would be to the medical side is to find out, do I need to be on medication? What are the recommendations for their particular
Right.
medical problems? There's a lot of other medical conditions that
that's
can
right.
contribute
Diabetes,
to.
blood pressure, and
Exactly.
all those.
So it's really important to make sure all those problems
Mm-hmm.
are addressed medically, and then we can work on the other stuff, the
Right,
habits
yeah.
and the nutrition and the lifestyle.
When the patient goes to you, the first thing you will do, sit down with them and talk of their background, or the diabetes, blood pressure, obesity. These are all cousins,
That's
right?
right.
And
Yes.
the diet pills.
Right. So there's a lot of different diseases that have obesity maybe involved. What I'm doing right now is coaching on the lifestyle piece. Later this spring, I plan to have an actual obesity medicine practice where I would be prescribing.
Right, yeah. So now what is your ideal client, and who do you help the most?
Yes. So I work specifically with professional women in midlife. So perimenopause and menopause, who are high achieving in every other aspect of life, but they need help with this one area. And they feel like they've tried all the things in the past, whether that's diets or there's different diet products. They may be on medication and they still feel stuck, like they're not able to get to that final goal or maintain their results.
Okay.
And that's where I can help kind of figure out, troubleshoot what's happening there.
What is happening?
Right.
So those are the kind of clients you have
Yes.
in your
Yes. So women a lot like myself.
Yeah.
Yes.
Yeah. So here the key points were the hormone changes affect the fat storage.
Right.
Can you comment on that? For the
Sure.
people, for our viewers who are on
Yes,
hormone.
yes. So for women, as we age, our estrogen levels go lower.
Right.
We may tend to store more fat in our midsection. When you combine that with being sedentary and the fact that we lose a little bit of muscle mass every year, really from the age of 30 onwards, and unless we're working to maintain that, the muscle mass decreases and the
Yeah.
metabolism can go lower. And when that happens, we may tend to hold on to fat more as
Hold
well.
on to more, yeah.
Right.
Excuse me. So those are the point you focus on, right?
That's right. Yes.
So now the question to be asked from the viewer's point of view. You talk about the three pillars: nutrition, mindset, and the movement. So
Right.
interesting. The three key points.
Yes.
Could you highlight our
Sure.
viewers about those 3 points?
Yes, absolutely. So first of all, with nutrition, especially when we're trying to lose weight,
Yeah.
it's really important to make sure we're getting enough nutrition, because it's easy to just try to cut calories, but we're not actually getting enough protein or
Right,
fiber or
protein,
macronutrients. So I want my clients to make sure they're getting whole foods, hitting all the different food groups, adequate protein, and really eating full meals so that we get back into that rhythm of actually feeling full and getting hungry and so on. Getting out of diet culture mentality
Yeah,
is the
right.
most important thing.
Stay away from the drinks.
Yeah.
Carbonated.
But to your point, we also have to make it work for people's lifestyle. They are so busy. So it's finding those ways that it's easy to incorporate these things and doable when we're really busy.
Yeah. So you must have, if I go to your clinic, there must be a whole chart, how much protein I can take, how much carbohydrate and this.
It's really,
Do you
it's
have a
not
chart?
so precise. It's really different for each person. So really, we look at where someone is at and what their goals are and their overall health, and then make an individualized plan for each person. So it's not the same for each person.
So this is about the nutrition. How about the mindset?
Right. Yes. So especially those of us who have been on a lot of diets in our life, we may have this fear of failure and worry that it's not going to work. So helping someone see that this is absolutely achievable no matter who you are, and helping them through all those little roadblocks that come up during the weight loss process, having a positive mindset.
Positive. It's so important
Very
to have a
helpful.
positive mindset,
Yes,
for anything.
yes.
My mind is all set. I'm going to do it and I'm going, right? Is that
Right.
what it is?
Well, and it's also if we make the focus about long-term health and feeling good and less about the scale, it's less stressful. And so
Right,
I
yeah,
really
yeah.
want women to focus on how do I want to feel when I'm 60, 70, 80 and beyond.
Right, yeah.
And if we focus on that, then it's easier.
Then, yeah.
Yes. And then the third pillar, which is movement.
Movement, yeah, very important.
Yeah, so my goal is for it to be joyful. We all need to move more, and it doesn't need to be complicated. The easiest thing to start is just walking.
Walking.
And then figuring out how to add some strength training to that.
Yeah, it's very important. I think walking is still the best kind
It's
of
wonderful,
exercise,
yes.
Moving. We talked about the nutrition, we talked about the mindset and the movements. So, can you comment on the medications? Many viewers are on
sure.
those medication.
There are many great
Same.
medications that are very effective for certain patients, and it can be the right choice for a particular person. I just suggest everyone speak with their physician to see if it's
Right, yeah.
appropriate. What I find is that a lot of times the medication can only do so much, so it's really important to figure out how to eat, the movement piece, how to make sure you're still getting adequate nutrition, because if you're losing weight very quickly,
Yeah.
you really risk losing muscle, and that's my main fear for especially women.
Yeah.
That we do not want to give up any of that healthy lean muscle and
Right.
bone mass.
Muscles composition, muscles, that's the most important, significant factor.
Yes.
In obesity and reducing
Right.
the exercise, yeah. So now what are the medications? GLP, that can cause muscle loss if careful, right?
Really, any
kind
type
of-
of dieting. So anytime you're restricting calories or you have less energy coming in and you're losing weight, if you don't pay attention to the composition of your meals and your exercise, you risk losing muscle. I think that the GLP medications
Right,
like
yeah,
Ozempic,
so much has been written.
yeah, I think there's just a lot in the media about them, but it's not particular to them. It's just any method of losing weight carries that risk.
Yeah, basically the key point to learn from this is to protect your muscles
Yes.
and be active.
And be
right?
active,
Okay.
yes.
Now, what are you have an exciting event coming in March. Can you comment on those?
Yes, I'm co-hosting a women's wellness retreat for perimenopausal and menopausal women on March 7th.
Oh, okay.
And it's called Thrive at Midlife, and I'm presenting with 3 other health practitioners to cover 4 different aspects of issues that women face at this age.
Yeah, so for our viewers to know that they can do the registration for that.
Absolutely. So to register, they could go to mdhealthstylecoaching.com/thrive to register for the event. There's early bird pricing until February 7th.
Okay.
And then registration goes until the event, which is on March 7th.
Okay, so these are all the important speakers that will be doing that are involved with the talk. Okay, that's good. So those are the key points. How can viewers register? Is there a process to register? You said.
For the event, yes. So they could go to the website mdhealthstylecoaching.com/thrive.
And where is this center? Where is this going to be?
It's at a place called Centerpiece in Troy.
In Troy. Okay,
yes.
okay.
Yes.
So that's good for the viewer interested. Now, another question to ask you for viewers who are interested in working with you. What programs do you currently offer?
Right. So I offer 2 programs. One is my signature program, which is a 3-month coaching program where I work one-on-one with clients.
Okay.
I meet with them weekly, and we come up with an individualized plan for their nutrition, movement, and we meet weekly to coach them through the whole process. Yes, and my other program is just a breakthrough consultation. It's a one-time meeting this is for someone who is on a good plan, but they may be stuck with a particular area, or maybe have reached a plateau and they just need help figuring out one area. That would be perfect for them.
Okay, and then I'm sure you must be doing webinars also, podcast wellness, people who cannot come in person.
Yes, all of both of my programs it's all virtual. So they can sign up for a free consultation call on my website, and we can see if we're a good fit and if one of the programs makes sense.
So that is very interesting to know. What does it look like to get started? What is the first step?
All they have to do is just go to my website, which is mdhealthstylecoaching.com, and there's a link there to sign up for a free call, and then we'll just get on a free Zoom call and see if we're a good fit.
So now here you have some exciting plans for later this year. Could you comment on those?
Yeah, so I'm planning on opening up a telehealth obesity medicine practice for Michigan as well as the surrounding states. And so my goal is to be able to provide comprehensive weight management if medications are appropriate for a patient. That way we could prescribe as well as provide the coaching and lifestyle support as well.
Lifestyle.
Yes.
Yeah, that's good. So that is like a telehealth obesity medicine practice.
That's right.
Launching spring 2026.
Yes.
I can hardly wait till spring is here, I'm so much tired.
Me too.
I wrote several articles about the winter blues.
Yes.
Holiday depression, winter blues, light and this and that. But now, I'm suffering myself with all this. For viewers who are struggling with their weight, feeling frustrated, what are some part of the advice you would give them?
I would say to
talking about food,
Yeah, so
food, meals,
right.
nutrition.
So I would get
Yeah.
back to whole foods as much as possible.
Okay.
Less processed foods, and paying attention to getting adequate protein at each meal, for the nutrition side. And for the movement side, I would say just get walking. And whether that's, I know
Right,
it's very
yeah.
cold right now, so
Right.
indoor treadmill or bicycle, just get some movement started. It doesn't need to be perfect, and then you can add on from there. And then add some strength training. And to do that safely, I always recommend people see perhaps a trainer, physical therapist, just to
Yeah.
make sure we're doing things correctly and avoiding injury.
Right. You know, the most important thing, prevent fall.
Yes.
There's so many falls
Yes.
going on, fall injury during menopause, post-menopause, fracture, breaking
Absolutely.
bone. So that is very, very important,
It's very
prevent
important.
fall if you can, right?
Absolutely.
Yeah.
Yes. And
But sometimes, Sonali, before you realize it happens, fall,
that's
you
right.
don't realize you can just trip under something.
You don't
with your
realize that you're
sandals.
getting weaker, you mean?
Weaker,
and then,
right, yes.
Yeah, so I think being proactive and just adding to whatever you're doing right now is a good thing to do.
So that preventing fall is very, very important.
It's very important,
Yeah,
yes.
Especially, like you're concentrating on menopause and menopausal phase.
Right.
It's very important. I think it is important in all, also
It's important for everyone.
for everybody. Yeah.
And, a trainer or a physical therapist can advise
Right.
on just simple exercises for balance and lower
Yeah.
body strength.
So the basically is for viewers to know, eat a well nutrition diet, more protein, avoid carbohydrate.
Carbohydrates are not bad, but it's really, if you're getting adequate protein and you're getting a nice whole meal,
Yeah.
you don't have to worry so much about low carb or not.
Right.
Carbohydrates are okay.
Yeah.
Yes.
So more emphasis for our viewers to know is to emphasize on your good nutrition.
Yes, absolutely.
And balanced diet.
That's right.
Yeah, that's very
Yes.
important. How can viewers learn more about you and get in touch?
Yeah,
You already mentioned, right?
that's right. So yeah, the easiest way would just be to go to my website, mdhealthstylecoaching.com, and there's just an easy link
Discovery
there.
call.
Yes.
What would you give our viewers, the last minute keynote advice?
Right. Is just get started. Find out who's the best person to help you, and just get started. It doesn't have to be perfect. Start with making small changes.
Small changes.
And that are sustainable for you, and then you can build on that.
Yeah, so this is the most important thing, for everything. Follow the regime, daily activities, daily activities in your life, and be moderate, right?
Right.
You cannot be too aggressive, right?
No, you still have to live your life. You still need to enjoy your life.
Right,
And it's
right.
just finding a way to still enjoy and reach your health goals at the same time.
Some people, like including me, I go on weighing machine every day. Do you think it is good or it is not good to weigh yourself every day? Is it good? Would you advise that?
I think it's good, actually, in the sense, as long as you're keeping, you're not getting too worried about the day-to-day fluctuations,
Right,
but
yeah.
it's nice to see long-term trends.
Yeah.
And that's more meaningful than one day to the next, because sometimes we can retain water,
Yeah.
when you're traveling, your weight can go up, and it doesn't necessarily
It
mean you have
doesn't.
increased fat. But those long-term trends are very meaningful.
Yeah. So that's very good, Sonali. You gave a lot of information to our viewers. I didn't think I will be able to cover all those, but I did. And so I'd like to thank our viewers for watching me on the Health Talk with Dr. Sonali Hamchandra. She is specializing in obesity medicine, and she also does the weight coaching process. I'd like to thank our producer for helping me produce this wonderful video. So I like to thank our producer, our TV crews, and until I see you all again, have a very safe spring, hopefully, late winter and spring season. Thank you again.